Thank you, Mr. Williams, and a pleasant good afternoon to everyone. And so this afternoon, it's my task, as per usual, to share with you the Health Emergency Operating Center's Situation Report. All right, so based on information from the World Health Organization, today we have 12,102,328 confirmed cases globally, along with over 500,000 deaths. In the Caribbean region, we have 64,590 confirmed cases, and the good news is we have as many as 28,780 recoveries. The death toll today, or as at July the 3rd, is 1,340. Now, within the Federation of St. Kitts and Nevis, to date we have tested as many as 651 persons, and as we are all aware, we now have a total of 17 positive cases, and of these, only 2 are active. We have 15 who have recovered. In terms of quarantine, at present, we have 181 persons quarantined in government-designated facilities. 2 persons are in isolation. Between January to present, as many as 931 individuals would have been released from quarantine. Let me just break down the data in terms of the numbers in quarantine. And so we are aware that returning nationals have been submitting requests for repatriation home. So at present, we have 60 returning nationals in government-designated sites, 32 in St. Kitts, 28 in Nevis. And we have a total of 123 students from the Ross University School of Veterinary Medicine also in quarantine. And I'll speak to that a little further on. So again, a total of 183 persons in quarantine. So earlier today, Honorable Minister Akila Byron Nisbet would have announced our 17th case. And so this comes 1 week after we would have announced the 16th case. And then there was a big gap. We had a gap of about 76 days between the announcement of case 16 and case 15. And so again, to date, we have 2 active cases in St. Kitts, so that brings a total of 13 reported cases on St. Kitts, 2 of which are active, the others would have recovered, and 4 confirmed cases in Nevis, all 4 have recovered. Okay, so let me just provide you some information regarding the return of the 7th semester students from the Ross University School of Veterinary Medicine. And so the Ministry of Health and the COVID-19 Task Force would have collaborated with the RUSVM, Ross University School of Veterinary Medicine, to facilitate the return of the first tranche of their students. And so on Wednesday, July 8th, 123 students arrived on island via charter. The task force held a series of meetings with key personnel from the International University to ensure that all established protocols were followed in the process. Now, the students consented to serial testing, and this, let me explain. This really includes a pre-arrival test, and so the students, while in Miami, they received a pre-arrival molecular COVID-19 test, and those students who tested negative, they were included on the charter to send kits. A similar test was done upon arrival, and please note, another test will be conducted on day 14 of quarantine. And so the samples that were taken upon arrival, these samples were processed by the Next Generation Laboratory. The students are all quarantined at the 5 residential halls or dormitory buildings located on the RUSVM campus. The residential halls on the RUSVM campus are guarded by the members of the Royal St. Christopher and Nevis Police Force, the St. Kitts and Nevis Defense Force, and the RUSVM security personnel. I repeat, all the students are on dorm on the RUSVM campus. The dorms are guarded by members of the Royal St. Christopher and Nevis Police Force and the St. Kitts and Nevis Defense Force, along with the RUSVM security personnel. And so in other words, the students who landed on Wednesday, they are not walking around in Bastille, and they are not on our beaches. All students were sampled upon arrival, and their samples were processed at NextGen Lab, and we have received all the results from this exercise, and all results so far are negative. The students will be tested again on day 14 of quarantine. Those students with a negative RT-PCR test result on day 14 will be discharged from quarantine and allowed to integrate into society. And so, in other words, only those students who test negative will be officially released from quarantine and allowed to integrate into society. The students will be monitored on campus in the dorms for the onset of any COVID-19-like symptoms. So now let's just speak a little bit about the cost of this exercise. The cost of accommodation for the 14-day period while on dorm on the RUSVM campus is covered totally by the Ross University School of Veterinary Medicine. Who is covering the cost for the COVID-19 molecular test for the students? Again, the cost for the COVID-19 molecular test will be covered totally by the Ross University School of Veterinary Medicine. The Ross University School of Veterinary Medicine is also covering the cost of the laundry for the students. Please note that the students themselves are covering the cost for their meals, groceries, and miscellaneous expenses. Ladies and gentlemen, please note that approximately 150 to 200 of the RUSVM students remained on island prior to the COVID-19 outbreak. All the students did not go back to the United States of America. And so, in other words, we have had approximately 150 to 200 RUSVM students living amongst us over the COVID-19 outbreak so far. The return of these students provides an appropriate test for our human resource capacity, laboratory capacity, and the structures in place to prepare for the reopening of our borders. The return of the students is vital for the economy of the Federation. The COVID-19 Task Force and the Ministry of Health endeavor to strike a balance, a better balance, between the appropriate public health measures facilitation of economic activity, and maintenance of the mental and emotional well-being of our people. I want to just explain a little bit now about outbound air passengers and COVID-19 testing. So the Ministry of Health, we've been receiving a number of requests from passengers who are traveling to other territories. And they are requesting molecular COVID-19 test. And so I want to explain the procedure. And so if you are an outbound passenger, you would have received approval for departure from the Chief Executive Officer of the St. Christopher Air and Seaport Authority, or SCASPA, for departure. And so you need to provide us with this approval. You also need to provide evidence of the requirement for the COVID-19 test based on the protocols from the country of destination, meaning the country to which you're traveling. And so you need to send this information via email to Dr. Keisha Liddy, who is our Director of Community Health Services. And then your molecular PCR test will be scheduled by the public health team. And so the next slide shows the information, the contact information, the contact email address for Mr. Denzel James, who is the CEO of SCASPA. And here you will see the email address for Dr. Keisha Liddy, who is our Director of Community Health Services. There's a little arrow on the slide. It's our Director of Community Health Services. And of course, you have the information, contact information for the Ministry of Health. And so you can just easily make contact with the Ministry of Health. Now, the Ministry of Health, and so ladies and gentlemen, we now have 2 active cases of COVID-19 on island. And so the Ministry of Health continues active surveillance, whereby we continue to test all suspected cases of COVID-19 and their contacts. And there is continued implementation of the COVID-19 prevention measures. And these include, and these measures have been repeating daily when I come before the mic. It's very important for us to continue wearing our face masks in public. That's going to protect you from the individual you're interacting with and protect the individual from yourself. Hand hygiene, using the hand sanitizers, washing your hands with soap and water, because it's going to prevent you infecting yourself with dirty hands. Physical distancing, ensure that you are at least 3 feet away from individuals. Social distancing, try and avoid mass gatherings. Ladies and gentlemen, these are the measures that are going to reduce your risk and my risk of exposure to the virus. The COVID-19 virus is relentless. It's not taking a break. And so I implore you not to let your guard down. Thank you.